Okay, so the first part, like always, wash your hands, greet the patient, make sure they are who they are. Tell them you're going to be doing a cardiovascular exam on them. Then you want to sort of do a general assessment. So you're looking for shortness of breath, you're making sure that she doesn't seem anxious, that she's not short of breath, that her fingers are sort of pink, if you'd have her mask off, that her lips aren't blue. So you're kind of looking for obvious reasons of distress, respiratory and cardiovascular. So you can see she's comfortable, she's calm, she's collected, she doesn't look like she's in cardiovascular distress. You want a radial pulse, so you're gonna get a pulse here, take it for 30 seconds, but don't tell the patient that for the second 30 seconds you're watching for respirations. So you're gonna watch then rise and fall of the chest. So count the pulse for 30 seconds, double it to get the pulse rate, then respirations for another 30 seconds and double that, okay? Blood pressure, just like you usually do, it does not need to be the long way, so just a regular blood pressure. If you're unsure of whether their blood pressure is normal or not, just ask them, what's your normal blood pressure? If they say 140/80, then go to 160 when you're actually doing the blood pressure, okay? All right, then the next thing is to make sure that the patient's at 30 degrees. So pull this out, you can lay back for me. So the patient should be supine, head at 30 degrees for the first part of it. You're going to inspect first, just like you always do. So kind of like you did when you were just general appearance, you're looking at the whole precordium. Do you see any pulsations that doesn't look normal? So you're looking across here. You'd want to be looking across the area of the PMI, which is just going to be about 5th intercostal space, mid-clavicular or medial to that. So I'm going to just lift up on the edge of your bra. So you're going to be looking there for that. Okay, so I don't see anything on inspection. Then you can palpate all of these places. So when you palpate, you want to be doing for different things. So heaves, lifts, and thrills. The heaves and lifts, you're going to be feeling with the whole hand and kind of just lifting. You want to do it in all areas of the precordium. So you're going to do right sternal border, left sternal border, the base of the heart, and the apex of the heart, okay? So you're feeling for all of those. Then to get the thrills, you only want sort of the ball or the palm. So again, the same locations, but you need to maybe do just a couple to get all the spots. So in males, if you want to, you can cover the whole area. In females, you want to not actually grab the whole breast tissue. If you need the female to lift the breast out of the way, ask them to do so. Palpating the PMI, again, I look. Sometimes it's easier with light across here. So while you're trying to find this, actually count rib spaces so you're in the right spot. So first, second, third, fourth, fifth. So fifth, and then it wraps sort of around here. So you're looking in the area that you think is the 5th intercostal space, about mid-clavicular line. I don't see it, which isn't necessarily a bad thing, then you can feel for it. And I can feel it right here. So then sometimes if you felt it, you can look to see if it's there once you know the location. I still don't see it. So it's probably just palpable, which is okay. Then the palpate the impulses of the right ventricle. If you think about the way that it sits in the chest, the right ventricle kind of takes up this whole spot. So you want to put your fingers kind of wrapped around the ventricle. You're again going to use the rib spaces. It should be the 3rd, fourth, fifth intercostal spaces, and you kind of rest the fingers on the xiphoid process. So again, the right ventricle's here. You kind of got your hand all around the right ventricle, okay? Then we listen. So this is the diaphragm. This actually has a bell on it, okay? So you're gonna listen all with the diaphragm, all with the bell. While you're learning, I actually want you to find the rib spaces. So find rib spaces so you know exactly that you're in those rib spaces when you listen. So aortic is in the right sternal border, second intercostal space. Then you have pulmonic, which is second intercostal space, left sternal border. And then you're gonna go down the sternal border. So the second pulmonic, third intercostal space. And tricuspid. And you're in fifth intercostal space. And then over to the apex. Then you do the same thing with the bell, okay? Okay, so that's auscultation in all the areas using the diaphragm and the bell. Then you change how you actually examine the patient. So again, these changes are just because you hear different things. If you don't see the PMI in the supine position, you may be able to feel it in the left lateral decubitus. So I'm gonna have you roll up facing that direction. Good. Yep, perfect. So again, you can use the light to see. This is where if you are short and you feel like you can't get a good exam, come around to the other side. And I feel it, and it's about in the same location. It's still in the fifth intercostal space, and it's about mid-clavicular, maybe a little medial to mid-clavicular. Then you auscultate. But this time you're only using the bell and you're only doing it at the apex. And you can roll back. So you want to listen for a decent amount of time in each spot to really hear a couple of cardiac cycles. Yeah, you can sit up. So then that way, if there's an irregular rhythm, you're actually hearing it if you go through a couple of cycles. So then the next position that you want to examine the patient is leaning forward. So you have the patient lean forward and you're looking across the sort of precordium again, looking for the same things that you did before. Is there anything, any movement that you see? Then you're actually palpating again for the same thing. So for heaves and lifts, and then just with the palm for the thrills. Then you palpate again over the apex. So I know that some of these you're palpating for different things, but you're in the same location. We still want you to do it a separate time for the apex. Then PMI to see if you can find that again. So if you can't find it right away, count again rib spaces and then follow it over. It's still in about the same position, which it should be. Then when you listen, you're only listening down the left sternal border. So my recommendation is that you actually hold your breath while the patient's holding their breath, so that you know if they need a breath in between you listening to all of those things. So I'm gonna get in the right location. I have you take a deep breath in and all the way out for me, and then hold your breath. And then take a deep breath in and out for me. And then breathe. So make sure you tell them to breathe when they're finished with it. I think that's it.
Just go over the rib space and which valve you're listening to.
Okay. So this is the second intercostal space, which is the aortic valve. Second intercostal space, left sternal border, pulmonic. Then third intercostal space, sternal border, still pulmonic. Fourth intercostal space, the sternal border, tricuspid. Then a second tricuspid, second, third, fourth, fifth intercostal space, still the sternal border. And then the mitral, or sometimes they just say listen over the apex, is going to be fifth intercostal space at that sort of mid-clavicular line.